What if we told you that there is a non-invasive treatment that can freeze away body fat and that over 90% of people who tried it were satisfied with the results? Well, that's exactly what is revealed in a clinical study published in the Aesthetic Surgery Journal. Based on research by Dr. Terence Tan from Halley Body Slimming Clinic, this peer-reviewed study, high participant satisfaction achieved using cryolipolysis for fat reduction of the abdomen and flanks, dives into the effectiveness of CoolSculpting, a fat reduction treatment that uses cold temperatures to target stubborn fat on the abdomen and flanks. If you got cross-eyed just looking at the findings, you are not alone. So let us help you by highlighting 4 key facts from the research paper that you should care about. The objective of the study seems straightforward. It determines participant satisfaction rate after CoolSculpting of the flanks and abdomen. Even though results show that satisfaction rate is high at 90%, this is not what is significant about the study, and here's why. Number 1. There had been many cryolipolysis studies conducted over the past decade, but here's the catch. Most of these clinical trials were done on Caucasians, and non-Caucasian participants from outside of North America are small and limited in number. In fact, non-Caucasian individuals, especially Asians, are significantly underrepresented in these studies. However, this study is different. The majority, or about 55% of all 116 participants were Asians. Of this number, a striking 84% of Asian participants are of Chinese descent. This is noteworthy as this was the only study at that time that investigated the impact of CoolSculpting on the Asian population. The results in the report are therefore reflective of CoolSculpting on our Asian body type against the Western population. So how did CoolSculpting perform on Asian participants? Which leads us to key fact number 2. Here's where the study gets more interesting. Dr. Terence Tan's research didn't just look at who was getting CoolSculpting. It also provides insights into how fat loss works differently between the Asian and the Caucasian populations. Despite having a lower body weight and body mass index, or BMI, Chinese participants exhibit higher fat volume reduction at both 8 and 12 weeks post-final treatment. This suggests that Asians may experience fat loss more rapidly than Caucasians, potentially leading to a greater volumetric fat loss. And this isn't just a rough visual check. It is a scientific research that uses 3D volumetric photo analysis comparing the results 12 weeks after participants' CoolSculpting treatment, which is far more accurate than traditional 2D methods. This method enabled researchers to accurately compare fat distribution patterns between Asians and Caucasian populations, revealing significant ethnic differences. It is therefore not surprising that satisfaction rate of CoolSculpting amongst Chinese participants is high, which leads us to key fact number 3. Now let's talk about results and satisfaction rate. At 12 weeks after the final treatment, close to 90% of Chinese participants were satisfied or very satisfied with the fat reduction procedure. The satisfaction largely stems from being able to see noticeable fat reduction, how their clothes fit their body, and whether the CoolSculpting treatment met their expectations, which translated to real-life confidence and everyday improvements. Which brings us to the next question. How reliable is this data? So key fact number 4. Unlike many previous cryolipolysis studies that focus on limited demographics, this research done in 2022 stands out as it involves a wider demographic population at international sites compared to similar cryolipolysis studies in the past. Participants were in fact recruited from 7 sites across 4 countries: Australia, Canada, Singapore, and the United Kingdom. Halley Body Slimming Clinic in Singapore was one of the 7 research sites for this study. It is also noteworthy that 1. Dr. Terence Tan, the medical director and founder of the clinic, is one of the research leads for the study, and 2. Data from Chinese participants were mostly gathered from Chinese participants who did their CoolSculpting treatment in Halley Body Slimming Clinic. What's more, this research employs a cross-verified questionnaire methodology to ensure the accuracy, reliability, and independence of its findings. Moreover, the prospective design of the study, which involves tracking participants over time, added another layer of scientific credibility to the findings. In summary, the research done by Dr. Terence Tan and his fellow researchers reveals that CoolSculpting fat reduction using cryolipolysis is not only effective, it also comes with minimal side effects and high patient satisfaction. It also shows that CoolSculpting For the Asian population, using the correct methodology and under the supervision of doctors with in-depth understanding of the treatment is effective, more so than the Caucasian population. This is a lot to take in from just one research. If you have any comments or questions, please leave them in the comment box below. Follow us for more thought leadership and insight from the field of medical aesthetics. This is Kayman from Halley Group of Clinics. Thank you, and I hope to see you next time.